I'd like to ask you both permission to use this video for educational purpose and on internet.
Okay.
Tell me about your symptoms before the surgery.
Well, my right leg was pretty much numb. So I was afraid I was going to fall.
And pain? Did you have pain?
No, it wasn't. It already passed the pain. It
Oh,
was
so
numb.
you had pain before and then
And it
literally...
gradually went into the numbness.
Yeah.
And I kept putting
How
it
long?
up. A couple of years.
Couple of years. I remember first time I saw you here, you had a jolly, like you are, but I barely could move you. You had, I think you were in a wheelchair. You had the leg up. Is that
Yes.
my memory correct?
Well, it was in a reclining
Yeah.
chair.
Yeah, in
'cause
a
I couldn't
reclin-
sit up.
You couldn't sit up. How long couldn't you sit up?
It was a couple of years.
Couple of years.
But it had been gradually getting
Just
there
getting worse.
before then.
Yeah,
So it was
yeah.
a long time, but I just never thought I'd ever have
Yeah.
surgery.
Yeah, well, why didn't you want to have surgery? Because it wasn't a question that something wrong in your back.
I just,
Yeah,
he didn't believe in it, so.
Oh, okay.
Yeah.
Now, as well, some people tell me that they have heard of other people having surgery and the result is not good. And so, was any of that player factor?
His father.
Yeah, yeah. So I'm going to turn around and show this. This is what you got. Your situation wasn't a borderline or anything. Look at that. This is almost grade 3, what we call L5S1 spondylolisthesis. Literally, your bone is about to fall off there. So it wasn't a question that something is wrong in your back. When was the surgery?
March 19.
4 months ago.
Yes.
Do you remember the surgery?
Yes.
Okay, what do you remember about it?
Waking up and my big toe was numb.
On the left side.
Yes, on the opposite side of the problem area.
Yes, so you had problem before the surgery on the right side. What did you feel on the right side when you woke up?
Nothing.
What do you mean
It
nothing?
was perfect.
It was good.
Perfect.
So the right side was perfect,
Yeah.
but then all of a sudden you have problem and numbness on the
Big toe.
big toe. Now today they're telling me 4 months after surgery, your pain is 1 out of 10. So pain is not the main problem anymore.
No.
It's the numbness that on the left toe,
Right.
on the left side. Now I'm walking. How's walking?
Good. I
Walking
feel
is-
like a clump a little bit
Yeah, yeah.
because I'm not, I don't know, it's just a clump.
How long did you stay in the hospital?
I think it was like,
3 days.
no, it wasn't.
2 days.
2 days? 2
Two-
days?
2 days?
I don't even think it was 2 days. I think
Yeah,
it was
I
less.
can look it up, but I think it was probably even less than that. But
Yeah.
now, and we did this, what we call the TransKambin OLLIF, this minimal invasively. If you remember, I said that your situation is truly borderline of what can be done minimal invasively, because the alternative to the surgery, we can open you from the front, realign the bone, and so on and so forth. And that would have been a lot bigger, much bigger surgery and so on. And but I think we are 4 months out. Your pain is 1 out of 10, and your walking seems to be all right. So, and you just told me about the symptoms on the right side. You said what percentage of the symptoms on the right sides are gone?
I think probably 95%.
95%.
95%. Yeah.
So, and this is what we did. We did a TransKambin OLLIF. We fused that disc there. And we disc amount, we talked about that. I go always 1 level above it to have a good bone growth. And here, the bone seems to be growing very nicely actually. And obviously still ongoing, healing is ongoing. But overall, tell me about your daily activity while I'm getting the record of the surgery. How does your daily activity today look like compared to before the surgery?
It's actually better than it was probably 5 or more years ago. I have
Oh,
a lot
it
of
is.
stamina, even into the evening.
Mm-hmm. And walking, any limitation in walking?
No,
How far could you walk before the surgery?
to the bathroom.
Oh,
That
few
was about
feet,
it.
few
Yeah.
feet.
Yeah.
So this is a huge improvement,
Yes.
right? So now this is the record of the surgery. So actually you stayed just 1 night in the hospital.
That's what I thought.
Yeah, my record that operation time was 41 minutes, and our blood loss, we lost about less than half a cup of coffee. Okay, that is what my note says, which is very little for this kind of surgery. So overall happy so far with the results? Okay.
Excited.
Would you have waited again so many years if you knew that's what's going to be?
Probably not.
So that is what I think it is, that, obviously not every person has a result like you, but we have statistically more result like you than the old traditional way where people stay weeks in the hospital, need 2 years of recovery, go from the front and back, and lots of limitation, lots of blood loss. So with this kind of method, we have been statistically very successful to provide results like this. Okay? Okay. Now, are you having fun with your cats? Because I think you are a cat farmer.
Oh, yeah, I'm a cat
Yeah?
farmer.
Yeah. Is that what it's called? Cat farmer?
No, breeding.
Breeder.
Cat breeder.
Cat breeder. Yeah. How heavy are those cats?
They can get up to be, probably 15 pounds.
Okay, so
Yeah.
not too bad.
Yeah.
Okay, not to the point that I would say don't lift them, because still be careful.
Okay.
You told me as well about something that warning about 6-month time frame.
Okay.
What do you understand about the warning I give to my patient about the 6-month warning? What is that warning about? Do you understand it now?
That's if I'm not careful and I'll abide by the rules. So.
Yes, and the core of it is that when people feel better, they forget they had a surgery. They wanna do regular or sometimes over activities that stress the spine. That's not ready for that.
Mm-hmm.
So they come and they feel great at 3, 4, 5 months, and then I see them 6, 7 months later, and then all of a sudden things go backward because they get to excessive activities sooner
Okay.
than they should.
That
Okay?
makes sense.
Okay, very good. Well, thank you so much for the interview.